today our topic is milk protein allergy, but from a pediatrician corner, I will more emphasize to the pediatric point, that is child age group, and obviously to some extent the adult part also comes, general part also comes, and this topic is very important for our day-to-day and clinical practice and for our good rewards from the patients and parents. Actually, this milk protein allergy presents in different forms in different age groups. Starting from the newborn, it's present in infancy, in toddler, to some extent in adolescent period also. It is present, but it is in lesser amount. In adult case also it is present, but much more lesser amount. But mostly it is present up to 1 year. After 1 year, the extent of this allergy is much lesser. But it is not that it is not absent. It goes totally, it is 100% curable. It is not like that. But starting from the newborn age group, in different type of manifestation we can expect. But in later age group, the manifestation is much more different. In newborn age group, the milk protein allergy first present with recurrent diarrhea, abdominal discomfort, distension of abdomen, cry, and particularly in nighttime cry, sometimes vomiting, regurgitation in this presentation. In the mother comes, this is very frequent in our day-to-day practice. Mother comes with this complaint, the baby is crying, and sometimes, but here the important thing, though there is abdominal distension, though there is some problem is there, but the weight gain continues. It is not like other diseases that weight gaining is not there. Weight gain is continued, but discomfort, cry, and the regurgitation, everything is present. So in this case, if you examine the patient, what you can expect? You can expect the tight abdominal distension is there, and the perianal region may be excoriated. Previously, it was thought that the perianal excoriation is due to milk lactose intolerance, and this lactose intolerance due to the deficiency of the enzyme lactase, which primarily in newborn, it is primary type, that is absence of lactase enzyme from for the manufacturing inborn defect, manufacturing defect. But in some cases also, like with some drugs, some medicines, in some infections like rotavirus infection, in diarrhea, there is temporary absence of this lactase and milk protein intolerance can occur. Therefore, during diarrhea, usually we advise not to give milk to the baby, cow's milk particularly. Now, this question of milk, what type of milk and which milk? Actually, in case of newborn, milk does mean primarily it is mother's milk. But allergen is not coming from the mother's milk. Actually, it is due to the cow's milk protein allergy. So, word or the terminology we can use the CMPA, that is cow's milk protein allergy. But in mother, the baby, which is primarily dependent on the mother's milk, in newborn, how he or she could get this cow's milk protein allergy. This is interesting because directly, obviously, he or she is not getting it. It is not either if provided if or he or she is not getting this artificial milk, that is complementary feeding, but indirectly from the mother's feeding. Like if the mother takes some biscuits where milk is there, she is taking some other drinks, milk containing drinks, she is taking some curd, or taking some sweets. From in that way, ice creams, the Cadbury, like chocolate, from these sources, indirectly the mother ingests the cow's milk and which affects the baby. How? Through the blood, it secretes, the allergen is secreted to the patient, and within the gut, there the particularly albumin part. Albumin has got two parts, alpha albumin and beta albumin. Particularly, alpha albumin is more allergogenic, and beta albumin is also allergogenic. But albumin is mainly contains this allergen part. But we know, obviously, protein has got two parts, albumin and globulin. In immunoglobulin parts of the milk, it is not responsible for the cow's milk allergy. So cow's milk, if you can give to some extent in hotter form, or if you do warm, so that the protein moiety is denatured, then the milk protein allergy you can minimize. If you can curdle the milk with like curd or along with tea, you are adding tea means you are giving the tannin. In that case also milk protein allergy minimized. So these I will discuss when the treatment part will come. Now, just these things is important, that cow's milk protein allergy is occurring due to the ingestion of the cow's milk directly or indirectly in newborn, and the treatment I will come in later. So in newborn, primarily it was thought, okay, let's finish another part, that in toddler or an adult part, this allergy may present in different ways. That is IgE mediated allergy like pain abdomen, some rashes within the skin, and some other allergic manifestations in later age group like recurrent wheeze or asthma, running nose, coryza. In that way, it can also present. So we have to remember when a patient is coming with allergy or asthma, we have to think about the dietary source. So from that background, what type of investigation we can do? We can do one allergy test directly. And before that, we can do simply one nasal smear for eosinophil, blood eosinophil test. We can do the blood stool pH, and we can check the reducing substance, whether it is coming stool or not, like lactose intolerance. In milk protein also, the pH is lower, that is acidic, and the cow's milk protein comes out to the stool, that is reducing substance is positive. Along with that, the lactose part comes out, therefore the reducing substance part also positive. So in this case also we can exclude in newborn also with this stool examination whether it is the abdominal discomfort or cries coming from the GI problem. Either it may be lactose intolerance or cow's milk protein allergy. So after that, we can proceed to the other forms of allergy tests like skin prick test, and the skin prick test or skin test or the patch test. Almost 20 to 40 types of allergen we can exclude at the same time. So in that case, that like mosquito-like a flare comes like wheal, it is called wheal. It comes up on the skin. So and it should be measured whether how much reaction, in which extent the reaction is going on. In cow's milk, we can confirm that allergy is present or not. Where the skin prick test is not possible, we can take option for the serum allergy test or directly immunoreactive test. So in that case also we can find out this in cow's milk protein allergy. Regarding the treatment part, first it was thought that the avoidance of this cow's milk is enough, and substitution with this isomil, lactose containing feeding. But nowadays, some other options, though it is a bit costlier, there is protein hydrolyzate or some hydrolyzed foods we can use in case of cow's milk protein allergy. We can home also we can form with chicken stew. In that way we can use this hydrolyzed protein formula. As a part of the feeding modification, this abundance of the milk with this either soya based or from other source of protein, we can think about that part. And for the symptomatic management, to some extent, there is a role of antihistamine, and sometimes the painkiller, that is antispasmodic, we can prescribe for the if there is diarrhea. So probiotic, prebiotic can be prescribed. In case of infant and newborns, in case of adult, only skin prick test along with the avoidance of the food for 1 year. And after that, if we slowly introduce this milk, usually it is tolerated. If it is not tolerated, then the long-term evidence is advisable. So this is more or less most practical approach about this milk protein allergy from all corners.